for Territorians. We have 2 new COVID-19 positive cases in the Northern Territory. It is likely that these cases are linked to the recent Darwin-Katherine cluster that will make these cases 5 and 6. There is a small possibility that these cases are not linked. Our contact tracers and health teams will work around the clock to trace these latest 2 cases. The first case I can confirm today is a 43-year-old Aboriginal male. He is fully vaccinated. He lives with 7 others in Katherine East, but also spends time on the Robinson River remote community. He had a COVID test on November 9, which came back negative. On Saturday, November 13, he was tested and this result came back positive today. We are treating him as if he's been infectious since November 10. Today, we also received a positive COVID-19 test in a 30-year-old Aboriginal female who is a household contact of the man I've just told you about. She flew into the Robinson River remote Aboriginal community on November 11. She's a resident of this community. She's symptomatic and underwent a point of care test today in Robinson River, which has returned an initial positive result. We are treating her as having been infectious in the Robinson River community since November 11. I will detail our response in Robinson River and surrounding homelands shortly. There are several things that concern us about today's updates. This is undoubtedly the most serious update I've had to give you since the start of the pandemic because it involves a case in a remote community, but we are very prepared for this. There is a lack of a clear link between today's first case, the 43-year-old Aboriginal male, and the previous cases linked to the Darwin-Katherine cluster. The last known positive cases from the Darwin-Katherine cluster were not in the community after November 4. We cannot presume the positive wastewater tests in Katherine were from these individuals. The length of time between cases in Katherine and the lack of a clear link means there may be seeding in Katherine. We have also received an additional positive wastewater result this afternoon for both catchments from November 13. For these reasons, from 6 p.m. today, we are declaring a 72-hour lockdown for Greater Katherine. This means you are only allowed to leave home for one of the 5 reasons. You have done this before. You have smashed it before. I know you will smash it again. The 5 reasons are medical treatment, including getting a COVID test or getting vaccinated. For essential goods and services like groceries and medicines. For work that is considered essential and can't be done at home. For 1 hour of exercise a day of one other person or the people that you live with and for no further than 5 kilometres from your home. And finally, to provide care and support to a family member or person who cannot support themselves. This includes separated families sharing the care of children. Schools will remain open. Unvaccinated parents will be able to drop their children at the gate. A mask mandate is already in place in Katherine and will remain in place but will be slightly strengthened. You must wear a mask whenever you leave the home. Exercise 1 hour per day is one of the reasons to leave the home. You are permitted to remove your mask if undertaking vigorous outdoor exercise. We need anyone with any symptoms in Katherine to come forward to get a test. We had a low testing turnout over the weekend. Please come forward if you have any of these symptoms. Fever, chills or night sweats, cough, sore throat, tiredness, difficulty breathing, headache, muscle pain, loss of sense of smell, distortion of sense of taste, nausea and vomiting, joint pain, loss of appetite, runny nose, or an acute blocked nose. Katherine residents have been terrific at complying with the mask mandate. We now need your help. We need you to get tested. Testing numbers have been too low in recent days. So to repeat, Greater Katherine will go into lockdown from 6 p.m. tonight. We have no exposure sites yet. The tracing effort is happening now. We will update these ASAP. Please pay attention to the media. Please pay attention to coronavirus.nt.gov.au. There will be exposure sites for Katherine and they will be updated as soon as we have them. Anyone who has recently left Katherine who has any symptoms should also get tested. To Robinson River. As I stated, we are treating today's female cases having been infectious in the Robinson River community since the 11th. We have already dispatched a rapid assessment team of 8 people to Robinson River and enacted a public health plan for this community. The rapid assessment team will include both health experts and police. It includes extra vaccines. The population of Robinson River is about 350 people. The vaccine rate for Robinson River is 77% full vaccination and 87% first dose, so a good vaccination rate in Robinson River. Everyone who is eligible and is yet to receive a first dose, or who is eligible but not yet had their second dose, will be offered one today. This rapid response may be the difference between saving lives. The rapid assessment team are already in the air. Robinson River and surrounding homelands will go into a lockdown, same time frame as Katherine, 72 hours from 6 p.m. tonight. The 5 reasons to leave the home will apply. In addition to a vaccination blitz, we will conduct a testing blitz in Robinson River and will aim to test every resident in this community within the next few days. The lockdown is also for surrounding homeland communities. The 5 reasons now apply to these communities as well. We're establishing contact with each of these homelands now and advising people to stay where they are. If they need anything, we will organise that. We're also sending in a team and making more vaccines available to the remote community of Borroloola, which is a nearby community of about 1,000 people with a first dose vaccine rate of 77% and a full vaccination rate of 60%. The priority tonight is Robinson River. We are ready for this. We outlined our surge response plans for this exact scenario, a case in a remote community last week. It is not a scenario we wanted, but we knew this day would come, and we've already swung into action to save lives. Today, our mask rules begin for all remote communities with a first dose below 70. Our testing rules begin on Friday. This will add an extra layer of protection for these communities, but is not a guarantee. We've always been concerned for our remote communities because of their mobility and vulnerability. They are at great risk from the impact of COVID, especially as Delta has emerged. If you are not vaccinated, please get the jab. It doesn't matter if you're in Robinson River or not. This is not a white fella disease. COVID does not discriminate. This thing is real. Don't wait until it's too late. Protect yourself and the community. Get the jab. We've had the rare chance in the Territory to get vaccinated before COVID gets here. Other places in the world, basically every single other place in the world, would have begged for this opportunity. Do not waste it. Get vaxxed. To everyone in Katherine, in Robinson River, this is tough news tonight. We've got through this crisis so far because Territorians have been the best. I know you will dig deep. I know you'll help each other out. We will get through this together. Thank you.
Thank you, Chief Minister. So we now have a couple more cases. We don't know the extent of the outbreak in Katherine. We've been concerned about further cases in Katherine for a few days now, which is why we issued the further mandate to wear masks and appeal to the community to come forward and get tested. That's going to be the key thing now. We need people now to come forward if they're symptomatic. The Chief Minister has given a detailed list of those symptoms that we're looking for. Everybody knows if they've got respiratory symptoms. Please come forward and get tested now so we can track this down. Our teams will be working, as the Chief said, overnight throughout the next few days to try and track down further cases. The fact that we now have a case in Robinson River is of grave concern, of course. The next thing that we ask people to do is to get vaccinated. Chief Minister recently briefed you all on vaccination and what the Doherty modelling shows. In this situation, it is the best thing we can do. Please come forward and get vaccinated to protect yourselves and protect your community. Thank you.
Good afternoon, everybody. Our thoughts go to the Katherine and Robinson River communities. This is clearly not news that you would have liked to have heard, but of course the active monitoring that goes on ensures that we do get an early heads up when these things occur. Having these responses now being brought to us, we can enact what we need to do to get on the ground as quickly as possible. For Katherine, what it literally means is back to where you were only a short time ago. Those roadblocks will be put back in place. That'll commence from 6 p.m. tonight. That'll be ongoing for the 72-hour period. The lockdown rules that applied have not changed. The only variation clearly is the vigorous exercise. Again, please don't push the boundaries on that. Just be fair and reasonable in your approach as we continue to try and support you in getting through this period of time. It will be a challenge, but as has been requested, if you can surge for the testing, that will certainly help us to be able to reach to as many of you as we possibly can, particularly those of you who may have been exposed and may be positive. That way we can get you out of this scenario as quickly and as reasonably as possible. You were excellent the last time, you were excellent the previous time, so please keep that level up and it'll be a credit to you and it will certainly help us to help you. As it relates to Robinson River, obviously that's more of a logistical challenge. We do need to mobilise resources out there. The Rapid Assessment Team will be departing shortly. They'll be flying into community on 2 separate flights. We'll be making sure that they're immediately on the ground, linking in with the relevant people. to get an assessment of what is truly on the ground, what we need to do to make sure that the testing can commence almost immediately. Vaccinations can be provided effectively from tomorrow. There's a great clinic out there, great clinic staff. I know that the people of Robinson River know those staff and have a great deal of trust with them, and that's reflected in the vaccination rate. So know that we're coming. We will provide support. The store has adequate stores for a significant period of time. We've already been linked in there to make sure that's the case. The road is somewhat passable, but it's pretty rough and messy conditions, so we're urging everybody not to travel to Robinson River. Please stay where you are. And of course, for those in Robinson River, once the lockdown comes into place at 6 p.m. tonight, please don't leave. And you will see our people on the ground first thing in the morning to come to you and let you know what's going on. More particularly, what we do want to do in Robinson River is minimise movement. And because this is the first time for you to have a lockdown, what we want to try and make sure you understand is that if you're going to go to the store, please only have one family member go to the store from the household. Don't go down there with everybody from the house. Please keep people at home and minimise, so only one person goes to the store to get what you need for the day. That way we can manage how many people are in the store, keep those numbers to a minimum, and make sure that there's no risk of transfer if indeed COVID has become more widespread in the community. The testing will be vitally important. We'll make sure that there's regular flights in and out to ensure that the testing is able to be turned around as quickly as possible. And the key is also for those homelands that are reliant on Robinson River, we will be making contact with you to ensure that you are also supported and we can facilitate testing for you as well. So again, the clear message is please just stay at home unless you need to leave for those medical reasons, and if you do, go straight to the clinic and only to the clinic, don't go elsewhere. And then equally, if you need to go to the store to get food. Again, this will be a challenge for everybody, but you will see a lot of people on the ground tomorrow that will clearly identify themselves as police or the rapid assessment team, and then I would suspect over the next 2 days there'll be even further staff that will head out there to try and help you and support you through this tough time. Heartbreak Hotel and Malandiri store, credit to them, they've already ceased takeaway sales, so that will be a great assistance to our front line to make sure that we can focus on the task at hand. So I pay my appreciation and credit to them for taking that community-minded decision. Also, the NLC we've been in touch with as it relates to what activities we're doing out there, so I thank them for taking the call and being aware of what's going on and assisting in communication to the community. Again, together we'll be able to step through this 72-hour window. We'll have our shoulder to the wheel. Hopefully you come on the journey with us and we get through it sooner rather than later. Thank you.
Question for the Chief, if you wouldn't mind. So Robinson River and Katherine are in a snap lockdown. Will Borroloola also go into a lockdown? What restrictions are going to be in place there?
At the moment, there's no positive case in Borroloola, and on advice, the movement between Borroloola and Robinson has been none to limited because of the road conditions. So at this stage, no lockdown for Borroloola. We'd ask everyone in Borroloola to stay where they are, but right now we have no reason to lock Borroloola down.
And the team's heading out there to Robinson River, so they'll be doing both testing and vaccination. Considering how quickly coronavirus can spread in a remote community, how likely is it that we're going to see more cases?
So we've obviously got staff on the ground as well, so this is additional people on the ground. So we have health staff and police on the ground as well as others that we can use. We will go into a swift testing and vaccine program. We know that Delta, nothing to do with a remote community, we know Delta can spread quickly, so it is a concern, but we are hopeful we caught this case early. She presented to the clinic because she was symptomatic, so I thank her for that. So she stepped forward. She wasn't tested because she was a household contact of the 43-year-old man. We would have traced her anyway because of that, but she actually came forward and got tested off her own back because she was symptomatic. So hopefully off the back of that, we've caught her early, but we all know that bigger picture as we get through that testing in Robinson River. It's about 350 people in Robinson River. So we feel at the moment with the resources that we're sending in and the resources that we have, that we can get a very good, quick picture of what the situation is in Robinson.
What's your plan for people who might test positive in Robinson River? Will they be flown into Darwin?
So that'll be a clinical decision, obviously, around the person and the severity of illness. This woman will be flown in, is my understanding, when she's ready, or when the clinical team says that she's ready. So CNR is ready to take those people. They'll be assessment decisions made by the people on the ground. I might just pass to Dr. Payne just to give you that clinical answer.
Yes, thank you, Chief. The plan is to fly people in up to our capacity. So initially, in an initial outbreak of this kind, we will be flying people in, and so reducing the risk of transmission to others in the community.
Dr. Payne, in many cases this is the worst nightmare we've all been waiting for. How confident are you that you can get on top of this early enough to stop it being a widespread outbreak?
Yeah. So we hope and believe that we have caught this early, certainly in Borroloola. In Katherine, we know we've had an outbreak there, and there's been a period of about a week in between. So there could have been some significant transmission during that time. Our teams, as they have done over a number of outbreaks now, will be working very hard to track that down. As I've said before, we very much depend on our community now to come and help us, come forward, get tested, get vaccinated. In terms of my confidence, we can't be absolutely confident. The only way we can be confident of tracking this down is if everybody cooperates to the full extent with the restrictions we're putting in place, and as I've said, comes forward to get tested and to get vaccinated. We're in a remarkably fortunate position in terms of having a vaccine and having reasonable vaccination rates, but we know that there are areas in the territory where vaccination rates are not adequate to hold back this kind of outbreak. So we're in a very challenging time. There's no question about that, and I wouldn't want anyone in the territory to be under any illusions that we are now in a fight to get on top of this. Thank you.
Dr. Payne, we saw some pretty dismal COVID testing numbers out of Katherine over the weekend. Talking to your team on the ground, do you know why those rates have been so low?
Yes, that was disappointing. I think the community perhaps has felt confident that we'd passed through this outbreak. Of course, we were watching closely for that, which is why we issued this appeal over a number of days for people to come forward. We can't allow that to happen now. We have to come forward and get tested. This is one of the principal means by which we're going to get on top of this, is track it down by people coming forward and getting tested.
Sorry, what is the vaccination rate of Katherine at the moment?
It's in the region of Katherine Town. It is actually quite high, but there are of course patchy vaccination rates in that community. It's around 80% for the Katherine community, but it's not so much Katherine that we're concerned about in terms of vaccination rates. It's about the potential transmission outside of Katherine through Aboriginal communities such as Robinson River.
And
Robinson River has a good uptake actually, which is a very fortunate thing. But there are obviously communities around there which are not.
and we wouldn't have had the genomic testing results back for these two cases today. So is it just a working assumption that they are linked?
Yes.
At the moment, do you know when we can get those results?
Those will usually, we do them ourselves now, so we can do that fairly quickly. We should be able to see them tomorrow, perhaps later. If you recall last time, it took some time to get those because the level of the virus was low. The level of the virus in our primary case is actually quite low again, so it may take a little longer. But I suppose it's pretty clear that there is a likely link of, in a period of 7 days, it's unlikely that we're going to get another outbreak coming from another source. It's most likely that's the source, and we will clearly operate on that assumption. However, we will continue to look for other sources.
I'm not sure if the Chief said, but can you clarify the vaccination status of the second case?
Not vaccinated. The first case was fully vaccinated, which we very much hope will give him some protection. He has an underlying condition, medical condition.
On the NT Health's website, it lists the population at Robinson River of 168, and from that it says that it's got a first vaccination rate of 87% and a second of 77%. Is the reason for the discrepancy there, is that because this doesn't include children, or do you know why?
Yes, I don't have the answer to that, but I think the numbers are actually yes.
my understanding, I can double check this if you like, but my understanding from that doesn't include the children. That's the eligible population eligible to be vaccinated.
So when you say, so if 87% of the eligible population is vaccinated, but it looks like there's 150 plus children who are unvaccinated in Robinson River, is that a concern?
Well, that's a population estimate. We'll obviously have hard numbers as we go through the population with testing overnight and tomorrow. Obviously, there's a lot of mobility in the territory, but the population estimate I had today was around, during the meeting just earlier, was around 350. And that's been our concern, as you know, in the Doherty modelling, that the median age of remote Aboriginal communities is around 25, which is obviously a lot lower than the median age for Australia, and that's one reason why it's 80% double dose for 5 and up is the recommendation for remote communities, as opposed to 80% double dose 16 and up. Yeah.
I have a question for Dr. Payne. How concerned are you for these people, given COVID is likely going to respond, the Aboriginal people will respond differently to COVID given that any underlying other conditions?
Yes.
How concerned are you?
So we've now got quite a bit of experience in Australia of the impact of the disease on Aboriginal people, particularly from the far west in New South Wales. Aboriginal people, as we expected, because of the prevalence of underlying conditions in younger Aboriginal people, are more prone. So we are gravely concerned about the impact on our Aboriginal communities. So all the more reason, please, and particularly for our Aboriginal communities to come forward and get vaccinated. Some vaccination rates in Aboriginal communities are extraordinary. They're fantastic, leading the NT, but others are not. There is still some hesitancy, even resistance to vaccination in particular communities. We've been engaging with those communities over weeks now, many months, weeks and months, with leaders, etc. Our vaccination rates have really increased recently. We saw with the recent lockouts and lockdowns in Darwin and Katherine that vaccination rates did really shoot up. We need those to continue. Over one weekend, we had 2% of our entire population came forward to get vaccinated. So we know we can do it. We know people can come forward. We just need, for those communities which are particularly vulnerable now, please come forward. You know who you are. Those numbers are out there. People can see them. It's quite clear where the gaps are.
There are still people out there who are saying the virus is not real, the vaccine's more dangerous than the virus. Some of that message is clearly getting through in some areas. I mean, what would you say to people who are still on the fence when it comes to vaccination at this point in the rollout?
Yes, thank you. You have now in Australia, over the next few months, 6 months, perhaps even a year, an almost 100% chance of getting this disease. It is coming. It's coming for us. We know a great deal now about the virus and how lethal it is, what proportion of people will die from it, but also the proportion of people will get seriously ill. It is much, much worse than seasonal flu. It's an order of magnitude worse than a seasonal flu. The vaccines have now been tested on vast numbers of people, but have been tested in real life on hundreds of millions of people. We know a great deal now about these vaccines and the risks associated with them. The risks are infinitesimally small compared to the risks of the virus itself. To delay now getting vaccinated has no logic whatsoever. The evidence is overwhelming, and I could just appeal to people to come forward. Protect yourselves. If you're only concerned about yourself, protect yourselves, but also protect your community. Younger people might feel that they're invulnerable, that they can't get this seriously. We know that it can very seriously affect young people, but if that's not good enough reason to come forward and get vaccinated, please do it for your family. It spreads very fast within families. Please do it for your community. Thank you.
Just one final question. How soon do you think we'll be able to see children under 12 be vaccinated here in the Northern Territory?
Yes. It's a little disappointing that we were hoping that it's not a criticism of the TGA, but we were hoping that approval for Pfizer for the 5 to 11-year-olds would come soon, before the end of the year. But I note that the Health Minister was interviewed over the weekend and said that it's likely to be January. So we've got a gap here, a significant gap here in terms of ability to vaccinate that group. Of course, it's important to vaccinate them in their own right to protect them, but again, in the territory, as we know, and as the Doherty modelling has shown us, it's that group that is really important to protect them and to protect others.
Just a quick question about the testing regime that's going to be out in Robertson River. Would it be accurate to say that most people, if not everyone, would be tested? And if so, would we be looking to do rapid antigen tests first, followed by a PCR test, if it is positive?
Yes, thank you. That's a good question. We will certainly be wanting to test almost everyone in those communities. We need very high rates of testing, and that's part of our plan, is when there is an outbreak in a remote community, to have very high rates of testing. Those teams that are going out there will be taking large quantities of swabs with them to be tested, but they will be tested with PCR at this stage. We're not at the stage yet of using rapid antigen testing as a reliable type of test in an outbreak situation like this. We need the most reliable test in these circumstances, which is the PCR, but rapid antigen tests will have their place. Once there is widespread community transmission, it's likely that rapid antigen tests will become very important to us. They're very much in our arsenal of tests available to us.
Thanks, everyone.